All intended parents are concerned for the health and well-being of their future children. Many screening and testing options in pregnancy reflect the various conditions that may impact a developing fetus, including birth defects and genetic conditions. Whether or not to perform any test and which to perform in pregnancy is your choice. When choosing any prenatal test, it is important to consider what the results may mean to you. For instance, if your baby were to have a genetic condition, would you want to know before birth? If you discovered your baby had a genetic condition, would it change your pregnancy plans? Does more information, with the possibility of uncertainty, cause you more anxiety? There are many prenatal genetic testing options that can be categorized as either screening or diagnostic for a particular genetic condition. Diagnostic tests such as chorionic villus sampling, CVS, or amniocentesis can provide a yes or no answer as to whether a genetic abnormality is present. Diagnostic tests require a medical procedure and involve a very small risk of miscarriage. Screening tests, on the other hand, may include ultrasound imaging, non-invasive prenatal testing, NIPT, also known as cell-free DNA screening, and maternal serum screening. These tests identify pregnancies as being either at lower or higher risk for a genetic abnormality. While they do not require a pregnant woman to undergo a procedure, they do not provide definitive yes or no answers. Maternal serum screening is an optional blood test that analyzes placental proteins in the pregnant woman's bloodstream. It has several different names, including quad screen, integrated screen, sequential screen, or first trimester screen, depending on the time during pregnancy at which the blood sample is drawn. Maternal serum screening can also be performed in conjunction with a first trimester ultrasound, evaluating the back of the baby's neck, called a nuchal translucency. This ultrasound is typically done at 11 to 14 weeks of pregnancy. Maternal serum screening can result in either a lower or higher risk for a broad range of genetic conditions and some birth defects. It cannot detect all genetic conditions or birth defects. NIPT is an optional prenatal blood test that can screen for certain genetic conditions such as trisomy 21 or Down syndrome, trisomy 18, and trisomy 13. It can be performed as early as 10 weeks of pregnancy. When a woman is pregnant, the placenta sheds fragments of DNA into her bloodstream that often reflect the genetic makeup of the fetus. Analysis of a maternal blood sample can determine whether or not the pregnancy is at higher risk for certain genetic conditions. While this technology is used to screen for many different genetic conditions and to determine sex of the baby, it is most effectively used to screen for Down syndrome. In fact, it is the single best screening modality available for this condition. It is important to recognize that NIPT cannot screen for birth defects. NIPT is not considered a diagnostic test and therefore cannot provide yes or no answers because its purpose is to detect only the likelihood of certain abnormalities. There are advantages and disadvantages to both maternal serum screening and NIPT. While maternal serum screening is a very good broad screen for various genetic conditions, its performance for the detection of Down syndrome is inferior to that of NIPT. Likewise, while NIPT has a very high rate of detection for Down syndrome, it is unable to detect other genetic conditions with similar accuracy. If results of maternal serum screening or NIPT suggest a higher risk for a genetic condition, a diagnostic test such as chorionic villus sampling, CVS, or amniocentesis can be considered to determine whether the fetus is truly affected by a genetic condition. Since both maternal serum screening and NIPT are screening modalities, they can both result in false positive and false negative results. When results of a maternal serum screening or NIPT indicate a low-risk result, it is important to recognize that the chance for the genetic conditions for which it is designed to screen is much lower, but not zero. This means that there is always some residual risk that remains. When deciding whether or not to proceed with a genetic screening test, It is important to consider how you would feel when you receive the results. Your choice for a particular test in pregnancy should reflect your own values and beliefs regarding the conditions for which you are screening. Most women will screen negative and feel reassured by these results. However, if the screening test suggests a high risk for a genetic condition, this may cause undue anxiety or confusion regarding what to do with this information. In such cases, consultation with a physician or genetic counselor is recommended to help determine next steps. At Mitera, we feel strongly that the decision to pursue prenatal genetic testing is a personal one. Some women prefer yes or no answers and therefore may choose to proceed directly to a diagnostic test. Other women prefer to first assess their risk and only proceed with diagnostic testing if their screening test reports a high-risk result. Some women opt for no testing at all. Regardless of what you ultimately choose to do, we believe that being informed is the best way to make a decision that is right for you.